Welcome everyone that's joining us. Hope you're having a great summer. And Gina and Laura and I'd like to say hi, and Kim. And also we have some very special guests, don't we, Laura? Do you want to just briefly introduce them before we get started on some other things?
Sure, I'd love to. It just warms my heart that we get to introduce everyone to Dr. James Sweeney and his wife, Kara Sweeney. And Dr. Sweeney, I'm going to have you kind of jump in a little bit because we met. I had a conference out in Kansas City at the Midwest Dental Conference, and you just chose to come hear me out of nowhere. I'm going to say that I don't even know what really drove you to come into my room, but we got to chat afterwards. But kind of tell everyone how we met.
I went to the Kansas City Dental Conference, and we saw that there was several different classes on, oral systemic connection, and we were interested in that, my hygienist and I. And so we decided to go to those classes, and you were one of them.
And we got to talk, and you signed up for testing, and that's really how I think this whole story began. So I'm excited for you guys to be able to share that, just share the journey from beginning to end. But even we can talk about just your dental journey, because really that's what I always say. We all have a very special dental journey, and then to share those missions with the rest of our colleagues and really the world is pretty unique. But I
Mhm.
know, Dr. Wilkerson, you wanted to answer a few questions as people come in. We usually give a couple minutes here. So there was a few questions. Let's tackle those, and then we'll jump back into getting started tonight.
All right. And we do want to update you all on some really exciting things that are happening on a national level. But what was one of the questions was, as far as salivary testing, Laura, you might answer this. Is there one best for analyzing HPV that you found?
Yeah, I think there's a lot of great tests out there. I am going to say tried and true. Oral DNA has just been one of the leaders in that. I think it's easy to do. It's an isolated one. We also have like STDs, things like that, that you can actually test for through other companies, and Simply Test offers that as well. And those are probably our two leaders that way. So it really depends on what you're looking for. If you're looking for certain strains or viruses, or you want a bigger panel to be looking at, those would be just my recommendation right now. But always remember, every day right now, our testing world is being constantly updated and changed. So that answer could change tomorrow, but that's where we are today.
Gina, there was another question that had to do with smoking and cigarettes and cancer. And um, obviously, the evidence is pretty strong, but any extra information on that subject?
Well, I would say one of the things that comes up often is it seems like we've known for so many years that cigarette smoking dramatically increases your risk of heart attack and stroke, no doubt about it. But people forget about any other forms of smoking, such beyond cigarettes, cigars, vaping, marijuana use. All of it gets into your lungs and really decreases the quality of your oxygen that's circulating throughout the body and damages your body in so many ways. So I'd say avoiding all of those at all costs, even being around secondhand smoke. And that would be I think the main thing to remember right now.
Okay. I wanted to update you all that weren't able to be with us in Chicago in June. Something really amazing is happening. And for us that go back many years on this journey of the oral systemic connection and airway and oral pathogens, etc., I think we're entering a real breakthrough right now. And it turns out that we were asked to be part of chairing an ADA symposium in June. I think we mentioned it to you before we went. And it was held at the ADA headquarters in Chicago. And we had over 100 attendees, including the immediate past president, the current president, and the president-elect of the ADA, and the executive director of the ADA, and many of the staff members that work at ADA headquarters. And the subject of the symposium was dentistry's role in complete health. And so we talked about airway, we talked about oral pathogens, we talked about Alzheimer's and diabetes and liver disease and the connection with oral health. And it was a very, very stimulating and exciting meeting. It turns out that the director of continuing education for the ADA contacted us on a follow-up call the week after that meeting. Myself and George Shepley and Mark Cannon had a long follow-up conversation in which she said the feedback they received was that that was the single best symposium they've ever held at ADA headquarters, and that the powers that be want to have a symposium every June for 2 days in Chicago. Next year in 2025, it'll be June 20th and 21st, if you want to get it on your calendar. Every June, we're going to host and chair a symposium at ADA headquarters on dentistry's role in complete health. And then they asked that we put together a 2-day program at the ADA SmileCon every year in October at the National ADA meeting. They want to have a 2-day track on dentistry's role in complete health and the oral systemic connection. And so all I can say is, this is amazing. And it's such a huge breakthrough for us that have been trying so hard to beat the bushes. Now we see the ADA really getting excited about it. The presidents and those that are leading the organization are all very on board with raising dentistry to be, the best specialty in all of medicine for saving lives. And we know that we can do that because there's no competition. And so I just want you all to know that, because you're on the front of the front lines. And, the curve of adopting these things hasn't even started to curve yet. And we're here talking about these things. And yet I think you're going to be seeing a lot of information coming out over the next couple of years. Also, our kind of mother organization where we all began, AOSH, the American Academy of Oral Systemic Health, is also very involved in this with the ADA as we work together. And IDM Scholar Society will be right in there too. And so just want to let you all know, as you are feeling sometimes like you're the only person maybe in your town that really is getting tuned in to this idea of why we have so much chronic disease and why oral health is such a critical player, that you're going to see more in medical literature, more in dental literature, more from the ADA, and more opportunities for learning and through dentistry than we've ever had before, starting right now. And so I couldn't be more excited. Laura and Gina were there with me and participated, and it was just really a real highlight for me of my whole career, and something that I know is going to be wonderful going forward. And we're going to get a bunch of you all involved in this too, as we have great opportunity going forward. So we're just thrilled to be in this together. James and Kara's story is exactly what we're talking about. And so we couldn't be more excited to share. And I haven't heard the whole story about Kara's health, but this is going to be recorded because we feel that her story and James' story is one that you will probably be wanting to share with others in your circle of influence. And we have asked if we could make that available, and they said yes. So Laura, I want you to just set the stage, and then we're going to turn it over to Kara and James to tell their story.
Well, I don't want to give too much away, but I am honored that honestly you both come together, I'm going to say, as a power couple, as a dentist and your wife, Kara, coming to share your journey, and not only your health journey, but really for me, a lot of it that I get out of it as your dental colleague, it's really a dental journey in itself. So I hope there's a lot of light bulb moments about that as you go through. But as I was sharing, I met Dr. James Sweeney at the MDC Dental Conference, and you started testing. And I'm going to have you pick up the story from here, because you signed up for testing and you got complimentary tests, but you not only tested some of your team members. Kara is a team member, so I'm going to have you introduce kind of your practice, what Kara does, but Kara ended up taking the test, and that's just where our story takes off. So I'm going to turn it over to the two of you from there and tell us about how that started.
All
right.
Change this to share.
All right. Can everybody
see that?
Everybody see that?
I don't see.
Not yet, no.
Okay.
Not yet. You can see here.
Oh, there's that.
There's the
that says
button
share
here.
now. Okay.
Now can
Sorry, we
everybody see it?
practiced, but I guess we didn't do a good enough job.
Yeah, no. Yep, right
All
there,
right.
you got it.
Okay, and if
Okay.
everybody wants to minimize there's a little minimize button you can push. It'll make it so that you can see the whole screen better. All right, go
All
ahead.
right. Well, as Laura said, my name is Kara Sweeney, and this is my husband, Dr. James Sweeney. And we're originally from Southern California, but in late 2020, early 2021, we moved to Southern Missouri. And we have a dental practice out here in Southern Missouri. And so this is our family. My husband is James. I'm a credentialed teacher, actually, but I do homeschool my children, or I did. Our oldest is actually going off to college here in a couple of weeks. And then I also run the office as the office manager. And so I get him in the door and James keeps them, I guess. I don't know. But our oldest son is JP and he's 18. And then we have Jabin and he just turned 12 years old. So that's a little bit about our family. James graduated from Creighton University Dental School in Omaha, Nebraska in 2006. And we just made a point to beeline it back to our hometown in Southern California and get started in private practice pretty quickly thereafter. So he's got 15 years of private practice ownership under his belt. And at one point we did have a couple of dental offices. And so, you know, we do have a lot of experience in that side of things. James was a member of the Tri-County Dental Society and the California Dental Association. And then since moving out here to Missouri, he's now the Greater Springfield Dental Society and Missouri Dental Society, and of course the American Dental Society this entire time. And then he also has a really great relationship with the Western Society of Periodontology. He had been going to their sessions for a while, and they're really big on collaboration between the periodontist and the general dentist. So he is a general dentist board member for the Western Society of Periodontology as well, and has been since 2017. And like I said, we have a practice out here in Ava, Missouri that we purchased about a year and a half ago now. And we love private practice. So yes, the saliva test, and I will get to that. But the reason why I'm here today sharing my story with you is I've really had unexplained medical issues for about 30 years now. And I'm more than pretty sure, as of about a week ago, I feel like I'm very sure that I've cracked the code. And, you know, it's not lost on us, the irony that I ended up marrying my husband is a dentist. It makes the story very powerful in some ways because it was such a mystery for so long. And also just there's no way we would have ever found what was going on with me had I not been married to a dentist. So I'm grateful for that. So I'd like to tell you a little bit about my health history. And I think it's important to start with the dental. The medical is a little bit longer, but I had, regular cleanings as a child, no cavities. I would say a majority of my issues were orthodontic in nature. My teeth were crooked and had all kinds of issues. And I actually have an x-ray here. This is not me. This is a patient in our practice, but this patient has something similar going on to what I had going on when I was younger. So number 6, and I don't know if you wanted to jump in and talk about this a little bit, James, because
Yeah, number 6 was kind of like this for Kara. They had to go and put a button on the tooth and orthodontically pull the tooth down with a chain. And we think that that's the procedure that caused all the problems. We're not sure, but we think that's where it all started.
I did also have on, yeah, if you could go back up. I had on number 7 and 10, they didn't like the shape of it. You were thinking that maybe it was,
They put some composite on the
yeah, like,
base of
but
it,
what did
I
you,
think it was.
sorry, I'm a teacher, not, I mean, I do run the office, but you were saying you thought that was maybe the angle of the tooth might have been the reason why.
Yeah,
but
they were just reshaping.
But they definitely did a lot of work on 7 and 10, as well as straightening my teeth. And I still have a crooked tooth in the front. I mean, they did what they could orthodontically. My teeth were pretty crooked, I would say. I also did have my wisdom teeth extracted. And then in my early college years, I was diagnosed with a couple of cavities. And so we filled those. And so that's kind of the extent of my oral health history. I have pretty good teeth. I don't really have a lot of problems with my teeth. So, and I never really have, even as a child. So that's kind of my dental health history. My medical health history on the other side is extremely extensive. So every teenage girl probably just can't wait. When's it coming? When's it coming? What is this? I was wanting my cycle to start, and it felt like I waited years for that to happen. And it wasn't until I was 16 years old that my menses finally started. And I know that's not typical. So could I say with certainty that it was delayed? I suppose not, but I have a strong suspicion that it was delayed. And when I started my cycle, it was normal to the best of my understanding, but after a few months, it tapered. It began to elongate and taper off until about approximately 17 years old. It had gone away completely. And we at home, we didn't have a lot of conversations about this. This was an uncomfortable topic for my mom, I think. And so I didn't really talk to her about what was happening to me. And I don't know why. I guess I should have. I'm willing to talk to you about it, but she seemed uncomfortable. So I just kind of didn't talk to her about it. I didn't know what was going on. And I just kind of was riding the wave, I guess. And I was dating this super handsome guy from church. Spoiler alert, we got married, but I was dating James at the time. And we were standing outside my porch talking one night. And all of a sudden, I just started seeing stars and was kind of losing my vision. And James was a lifeguard at the time, and he recognized that I was about to faint. And he caught me and he laid me down. And he's like, when I came to, he said, "What's going on with you?" And I felt comfortable enough with him to share, well, I haven't had my period in a while, like maybe a year. It's been tapering off for a while. And he was like, "That's not normal. You need to do something about that. You need to tell your parents and you need to go to the doctor." And so I said, okay, it was something I knew I needed to do. It was just a little uncomfortable for me, but I did tell my mom and my dad, and they went ahead and got me scheduled with our family doctor. And now looking on it, it was not the best doctor's visit. So when the doctor asked me what was going on, I explained to her that my, period had started, but then tapered. And she wanted to do a pap smear on me. And I told her, I'm saving myself for marriage. I'm really uncomfortable with that. Could we maybe do a blood test or something else to see what's going on with me? And she told me, well, there's really not much a blood test will show me, but this is a common problem for girls your age. So let me go ahead and put you on birth control pills for 3 months, and let's see if you have your cycle. And then we'll take you off and see what happens with your cycle. So that's what I did. At 17 years old, she put me on birth control for the 3 months that I took the birth control. I had my cycle. It was different. It felt different than my natural, like normal one, but I did have a cycle. And then the second I would go off for 3 months, it would be nothing. And so I did 3 months on, 3 months off, 3 months on, 3 months off, 3 months on, 3 months off with birth control for about 3 years. I don't know why the doctor decided to do it that long, but that's what she decided to do. And then in my junior year of college, fast forward, we're engaged now. I call and say, hey, my birth control prescription is needing to be renewed. And she said, maybe we should have you take a blood test. And I said, okay. So I took a blood test, and then I got I'd like you to have an MRI. I didn't have an explanation as to why, but I did the test because that's what the doctor wanted. And I was good at following orders from the doctor. So, after taking the MRI, had an appointment with her, and she brought me in the room and said, we took your blood and there's clearly something going on with your hormones. Either you have something really wrong with your thyroid or you have a pituitary tumor. And I said, a pituitary tumor, where is that? Where's your pituitary? And she said, well, it's at the base of your brain behind your eyes. And I said, in my head? And then she said, yes. And I said, okay, well, which one is it? Is it my thyroid? Is it my pituitary? So she goes, well, let me see. And she goes, oh, they didn't give me the results. And she leaves me in the room, bawling my eyes out. I remember so distinctly, like there being a patient across the way watching me cry. I'm, a young girl who just was told this information, and I was freaking out. So she comes back and confirms you have a tumor growing in your head, on your pituitary gland. And I found this out during Christmas break. So it made for some depressing holiday time with my family. But during that Christmas break, she had referred us to a neurosurgeon to go ahead and discuss the pituitary tumor and what it is that we could do about the tumor. So a local neurosurgeon that was recommended to us, we went, and it was my fiance at the time, his mother, who was a phlebotomist, so kind of in the medical field, and then my mom, my dad, and my brother. So it was like a whole group of us. We went into the neurosurgeon, and I was asking him, what does this look like? Where do you enter to get to the tumor if you have surgery, and if I do the surgery? And he said, well, it depends on whether it's soft or hard. And I said, what do you mean by hard? And he picks up his phone receiver and starts banging it on the table. Hard, hard. And so anyway, by the time that appointment was done, I was so overwhelmed and scared. I just was beside myself. Very, very scared. And I was 20 years old. Facing your mortality at that age is not easy. I was young and about to get married. And so yeah, that was it was a very emotional time for me. So luckily my mother-in-law was there. She's in the medical community. Like I said, she was a phlebotomist at the time, and she really did not, none of us cared for the neurosurgeon. And so she said, you need a second opinion. And she really did some research and found Dr. Martin Weiss at USC Medical Center and said, I think you should go to him. He does multiple pituitary tumor surgeries every single day. So I went ahead and made an appointment with Dr. Martin Weiss. He was amazing. He had the bedside manner that I really needed. And he went ahead and, I will say too that I had lost my peripheral vision. They did a field vision test, and I didn't even realize it, but I had failed all the peripheral. The tumor was clearly pushing up on my optic nerve, and they were thinking at the time that it was maybe a stage 2 or 3 as they were looking at the imaging. And when they got in and actually did the surgery, they removed as much of the tumor tissue as they could. But there was some residual tissue that was left that they were not able to take. The surgery was done transsphenoidally, so they went through my upper lip here and behind the nose and behind I believe behind the sphenoid sinus there to access it with, the minutest of instruments, and pulled as much of that tissue out as they could. And then post-surgery, the neurosurgeon said, did you know you had a sinus infection? And I said, no, I had no idea. I breathed clear. I didn't have pain. And he said, well, you did have a sinus infection, and, you may want to keep an eye on that. And I didn't really know what that meant, because like, how do you keep an eye on something you can't feel and don't know about? But I just definitely remember that conversation. So surgery was in January of 2001. And then in May of 2001, they decided to radiate the residual tumor tissue that was left. And so that basically they screwed a metal halo, like literally with screws. And as I was worried it would show in my wedding pictures, which was going to be like less than a month later, screwed a metal halo around and kind of locked me on the table. And then they took cobalt ray radiation and cross-beamed it on the residual tissue. So that was a pretty intense surgery or procedure as well. Because if they missed, you could go blind if they hit your optic nerve, or, lose brain tissue or whatnot. So it was just a very intense moment of my life. So after doing the radiation, less than a month after that, I was married to James, and I was, finally had something happy happening in my life. We entered that marriage not knowing if we would ever be able to have children, or what, my health future looked like. I didn't know what I was going to do about that at the time, but I knew that I was done with doctors for a while. That was for sure. Dr. Martin Weiss was absolutely amazing. He was kind of a redeeming light in that process, but my parents had HMO insurance, and between trying to deal with the insurance companies and just dealing with just this major procedures and things, it was very overwhelming to me, and I wanted to walk away from doctors for a while. So we got married and graduated college, and James was accepted to a few schools, but he chose Creighton University at Omaha, Nebraska. I still, after the procedure, my menses never came back. I was tired all the time, and just was always feeling run down. And in James's junior year of dental school, we decided we wanted to go ahead and attempt fertility treatment. So we tried Clomid, which still sorry, James, because I was on that medication, but made me very emotional and didn't do anything for me. But we finally did IUI treatments. And on the second round, we had one little egg to fertilize, and it was successful, and I was pregnant. And that was truly a miraculous moment for us, because as I had said, we just had no idea if we could even get pregnant. And I would say at this point in our marriage, we wanted at least 3 or 4 children, which grew to like 7 over the years, but we wanted a lot of children. And so in December of 2005, I gave birth to our firstborn son, who's about to go to college, JP. So James graduated dental school, and we returned to our hometown area to start our dental practice. I still was just tired a lot all the time. I felt like something wasn't right with me, but, I kind of began to say, okay, well, this is my life, what else could I do? So During this time, well, I say, what else could I do? I really had a lack of trust with doctors at this point. I was nervous about taking synthetic hormones, and I just wasn't sure how I wanted to approach my health, and I had a lot of trust issues. During this time of our lives, we started Hometown Dental in our hometown area, and I continued having hormone issues, no menses, and I developed gallstones, and just had a busy life and tried to keep up with it and keep on living it. And then there was a point in my life where I just really got sick of feeling sick. Like, I really got sick of it. And so I thought, I need to be researching more health-minded things, and I need to focus on nutrition and exercise, and I need to fix myself. I didn't want to go to a doctor and just have him throw pills at me. I had 3 years of birth control pills being thrown at me, which did absolutely nothing for me other than make my hormones go out crazy. And then the entire time I had a tumor growing in my head. I wanted to feel better, but I wanted to do it without a bunch of pills being thrown at me. And so I just went on this crazy, like 5 days a week, I was working out, I was juicing, I made extreme changes in what I ate. I lost some weight, I was feeling better. And then one day out of nowhere, I had a period. So I was, I think 32 at this time, right? So my last natural period had been when I was 17. I had a period, and it was a miracle again, a second miracle. And I must have been ovulating because even though I only had the one, 4 months later, I was pregnant with our son, Jabin. And he really was a miracle baby for us. I mean, we had tried fertility after JP unsuccessfully. And so to get pregnant naturally was pretty incredible. So we named him Jabin, which means God has created. And we really were just so blessed to have 2 children at this point, and feeling pretty happy at that point in our lives. And here's some pictures of us in our scrubs. The boys kind of grew up in the dental office. So, but at this point in my life was very, very busy. I was homeschooling. I was chasing a toddler around. Despite all of my friends and family saying I was completely nuts, I decided to keep my gallbladder. So I was passing gallstones amidst all of this, which was not fun. And if our life wasn't crazy and busy enough during that time, we decided to buy a second dental office in LA County, which was an hour and a half away. And we had extra room in that commercial building. So we went ahead and started an escape room business as well. So we had 2 dental offices and an escape room business. I was homeschooling. We were so exhausted. We even had an apartment in LA that we would crash at when we were too exhausted to drive home. So that was a very busy time of life, and a time when there was just no way I was going to be exercising 5 days a week and juicing, which is frankly a full-time job if you've ever done like multiple times a day juicing. We definitely tried to eat healthy, but I was for sure burning the candle at both ends. I was exhausted. At least, I felt run down like I always did before, but at least now I had a reason to feel like that because we were just running at, 100 miles an hour. But it was a very eventful time of our life. And around this time, I decided to go ahead and give doctors a second chance. So my thought process was, I'm going to try and find a homeopathic minded doctor that's an MD, so they can still maybe prescribe me something if I really needed it, or prescribe even a test or something that I may need, but be a little bit more willing to let me have involvement in my health journey, which was important to me. I had more than one experience where it was kind of like, sit down, shut up, and take our pills. And I didn't want that anymore. So I was really trying to find the root cause of what was going on with me. I enclosed here on the screen, and I'll show you a part of Dr. Martin Weiss's, this is May of 2001. So this is after my surgery, but before my radiation. And he's writing to the radiologist. And he says, I had the pleasure of seeing the privilege of seeing Kara in the office today for her. I can't read it because it's actually blocked, but let's see. For her visit today, she tells me she's not having menses, although she obviously needs some time for that, time to elapse for that to occur. So my neurosurgeon clearly thought that the removal of my pituitary tumor would bring back my menses. And we talked about that, but it just never happened. And the solution was then to go to an endocrinologist, but I was leery about going to an endocrinologist and what the synthetic hormones may do to my body. I had already gone through sort of like this crazy cycle with the birth control pills, and I was just not sure I wanted that. And I was just really wanting the root cause of what was going on to be found. So I searched a lot of different homeopathic doctors. The closest one I found was 3.5 hours away. So I would make that trek quite a bit. And then we were, like I said, in Southern California. At one point I came across Dr. David Minkoff in Florida. And I thought, I'm going to go to him. He seems like somebody who wants to get down to the root cause of things. So I started going to Dr. Minkoff in Florida, and James and I went together to the appointment. He was a part of a documentary series talking about root canals. And so he's kind of passionate about the teeth. And that was one of the first questions he asked was, how are her teeth? And James said, great. And so he began doing testing and looking for things under the pretense that my teeth were great, because they were, or so we thought. That doctor recommended that I do a thermography as a part of an annual screening for breast cancer. And so because of the flights out to Florida and whatnot, I decided I wanted to try and do a thermography locally. That way I could save money on hotel stays and all this other stuff I was doing to try and, get myself to a homeopathic doctor. And so I did, a local place here in Missouri was advertising thermograms. So I did the thermogram. Unfortunately, it wasn't quite what I was expecting because I was really wanting imaging. But one of the things that came back on the thermogram diagnosis was that something was wrong with my teeth. And James and I thought that was really odd. Of course, he checked me out. He's been my dentist at this point for like 18 years or something. So he's very familiar with my oral health, and we're like, that's weird, So I decided to go ahead and get a second opinion thermography, and this is the imaging here. And again, it indicated oral pathology. There's a spot next to my nose on the right side, and then this sort of like drainage that's happening on the side of my mouth. And the report is looked at by a team of doctors. And so, second opinion, there's something going on with your teeth. And again, we're left scratching our heads because I don't have any pain, no problems. My teeth look great. Just not really understanding where that could come from, and wondering kind of in the back of our heads, what is that? Why do I keep getting something wrong with my teeth? So in the dental chair, James just didn't feel that there was any clinical evidence to support that. There was no dark circles over any of my roots, or bone loss indicated on the in any of my x-rays. I didn't have any discomfort or any signs of an abscess. So it was kind of a baffling thing. And then James attended a course that frankly changed my life. And it was a course about saliva testing. And so Laura was giving that course, and I wish I could have been there to actually hear you talk about it, Laura. I'm going to have to go to one of your courses someday. But James and our hygienist went to the course, and they both came out just on fire for saliva testing. And my husband is a pretty even keel guy. So for him to be so passionate about something, I was instantly, on board, because he doesn't usually get like that. And so they start talking about the oral systemic connection, and this idea that, 50% of heart attacks can be traced back or connected to oral bacteria. And I was like, whoa, wait, what? you know, like, that's crazy. Why isn't everybody talking about that? And they were telling me things about disease and the connections that these oral bacteria can have to them. And I'm adopted. I found my birth family in my early 20s, and which was a huge blessing. And that's a whole nother story. It was a good story too. But on my birth mother's side, my grandfather and my grandfather had all 4 valves replaced, major issues with his heart. And my grandmother had Alzheimer's, to the point where she was having trouble recognizing her children in the end. And, you know, I try to not be someone that worries, but I have to admit, like, in the back of my head, I'm like, is that my future? And when I heard about the saliva testing, I was so intrigued by it. And I told James, like, you know, maybe if I had something going on in my mouth that indicated cardiovascular disease or connection to Alzheimer's or cancer or something like that, we could do something about that. You know, at this point in my life, I'm always the sickest, right? I always feel run down. I always feel sick. If our family gets sick, it takes me forever to get over it. And I've said more times over the years to him, like, if I feel like this in my 30s and 40s, what am I going to feel like if I contract something like this when I'm 70? Would I even survive it? Why do I feel like this all the time? I know I don't eat perfectly, and I know I could lose a few pounds, but I'm like, man, we are so health minded. Our family is, and it just never made sense to me why I felt so yucky. And, you know, anytime I can have a tool like this where I can, like, almost like take my own health into my own hands, right? I can see real results, and then I can actually do something about it and try and make them better. I was very interested in this. So, as part of signing on, there was an offer to do some free testing for our team. And we were just so fascinated by the saliva testing. We actually decided to do our entire team and our family. So our 2 boys and myself and James, as well as all of our staff, went ahead and saliva tested. And, you know, when I got the results back, I was like, ooh, that doesn't look good. Okay. You know, we had a consultation to talk about, what does this mean? Because, you know, now you got your results. It's, what do you do about it? And what is it looking like? And how can we change the course of this? And so we're chatting about what these numbers mean. And, you know, it gets brought up that I've got this orange bacteria, orange complex bacteria, that's UML. It's off the charts. And it gets brought up to me, you know, do you have maybe an implant or a root canal or something? I'm like, no, I have great teeth. You know, I mean, I've had a couple of fillings when I was younger, but I have great teeth. No, I don't have anything like that. And it was just this conversation of like, hey, this is, something's going on here. You need to take a look at this. Something's going on here. So it was really pointing to like maybe a hidden abscess. And I found that to be really interesting, considering the 2 previous diagnoses that I had had from 2 separate thermograms, that something was going on in my mouth. And so we were like, because I had these numbers, I went ahead and went on antibiotics, and we planned to do a cleaning. So the day we did my cleaning, we also went ahead and did a really, you know, all the x-rays again. And James and our staff members are like looking at these x-rays, and they're just scratching their heads like, there's nothing here, you know. It's the problem. And, you know, as we were talking about, okay, if I did have a hidden abscess, where would it be? I had such limited oral health history. It really wasn't difficult, after talking for a little while, to track the issue down to number 7. I had that button surgically placed on number 6. And James was wondering if during that process, 7 and 6, you know, maybe there was
The root of 7 probably got exposed, because we cold tested and we found that number 7 was not alive. And so that combined with the thermogram kind of pinpointed number 7 was the problem.
And you can see that the canal is more narrow and maybe looks a little calcified. Like it's had a lot of work on it. When I was young, I was 14 years old. So at the time that we're taking these x-rays, I was 44. So I'm going, wait a minute, like, are you saying that maybe I've had something possibly wrong in my mouth for like 14 minus 44, 30 years? That's kind of a crazy concept. And we're looking at the tooth. We don't see bone,
Problems.
yeah, bone problems. There's no typical things, but like James said, he cold tested and the tooth was definitely dead. So we did a cleaning and I told him, dig, get it all out. I was like, don't be nice. Do not leave anything behind. So he did my cleaning, and we went home and we had a lot of discussion about it, and prayed about it. And I wanted to, and maybe James might want to speak on it too. I reached out to our office that we used to own in California and asked them to send me my x-rays. So here's a history of my x-rays I don't take a lot of x-rays ever since, having a tumor growing in my head. I usually avoid taking them, but I did have some on file that we could kind of look at. So I don't know if you wanted to speak to
I mean, you can just see that there's not really a lot of change over 17 years. The tooth kind of looked the same, never had pain, really nothing clinically that indicate a problem. I mean, there's no reason to even cold test it until, these other signs kind of pointed to that area that we even decided to cold test it.
So we, after thought, and we knew that we could do some more testing, or maybe not be as aggressive, I suppose. But at this point, I knew there was something going on in my mouth, and I was really starting to wonder systemically, like, could this have a connection to more than, to my health history, basically. So after discussion and prayer, like I said, we went ahead and made the very difficult decision to go ahead and extract a tooth in the front of my head. And that's what we did. James, did you want to say anything about
so just kind of to put it together, what we decided to do, we decided to be aggressive. So we put her on a combination of amoxicillin and metronidazole, and we did a thorough cleaning while she was on the antibiotics, and then also extracted the tooth kind of right in the beginning of the antibiotics, and then let her take the rest of her course, because we really wanted to be aggressive to make sure we got rid of all the bacteria.
He removed the periodontal ligament.
Yeah. I cleaned it all out with once I took the tooth out, cleaned out the periodontal ligament, and there was a little bit of a what? Oh, there was a little bit of a cyst, I think right at the root tip that I got out as well.
Did someone have a question? I didn't know. Okay. Well, I guess we'll have questions at the end, I suppose. But so went ahead and extracted the tooth, and the interesting thing during the extraction, I was definitely very numb, but I could feel it in my sinuses. It first was kind of like in my cheek, and then just traveled up above my eye. I'm not talking nerves. I'm talking like in my sinuses. I had like pain above my eye as he was wiggling and pulling that tooth out. And the whole time I was thinking to myself, this is so weird. Why am I feeling my sinuses so intensely? And it made me think back to the comment my neurosurgeon made. Did you know you had a sinus infection? And I thought to myself, because now at this point I'm thinking, have I had a tooth infection for the last 30 years and didn't know it? How is that? That's just so crazy. I mean, I'm married to a dentist. How does that even happen? And then I start to suspect that it's not just a tooth infection. I think I might have had a sinus infection as well. So I went home and I started pulling some of my documents, and this here in the middle, this is from the imaging center where I got my scan right before surgery, which was January 11th, 2001. Number 3 on the examination, rather extensive sinus disease is seen involving the right and left maxillary sinuses and both ethmoids. So they went transsphenoidally. And so I had major sinus infection here in my maxillary, and then the ethmoids are over here by your eyes. They went transsphenoidally, so I'm not even sure they went to my frontal sinus, or they might have found infection there as well. I can tell you I was feeling it up there during the extraction. So that was pre-surgery. And then post-surgery, I didn't even realize this, but the residual tissue that they radiated, part of that residual tissue that they had radiated was actually in my cavernous sinus right here. So they were happy to report, this is May 4th, 2001. So after my surgery and right before my radiation, happy to report that the large tumor's gone. There's a small amount of residual tumor residing in the right cavernous sinus. The tumor preoperatively grossly invaded the right cavernous sinus and actually encompassed the carotid artery, which would preclude a total removal without any undue risk. So I had surgery, or I'm sorry, I had on my pituitary gland, the tumor was growing, and it was actually pushing on my optic nerve, which is what made me lose my peripheral, and it was wrapping around the carotid artery. And after going in, even though they had thought maybe it was a stage 2 or 3, had discovered it was actually closer to a stage 4. And so part of what was radiated were this cavernous sinus area where the tumor had also invaded. And so, you know, when you think about how close your sinuses are to the root of your teeth, you can see how, I mean, for those of you who are in the dental field, you know that that can happen anyway, right? That's part of the thing. You don't want an infected tooth to travel up and cause issues. Well, in my instance, I absolutely believe that's exactly what was happening for many, many years. So I just was in the dental chair feeling this and thinking about my sinuses and just the connection of, you know, the last 30 years or so. So James set to the task of repairing my tooth because I said, well, selfishly, I want to not walk around with a hole in my head, and I'm married to a dentist, so it's probably negative marketing. So we need to deal with this. So James actually decided to take my tooth that he had just extracted, and I don't know if you want to talk about the surgery or what you did.
I cut the root off and sealed it with composite, and then we basically used composite to make a Maryland bridge and put it back in. You can see the color's a little bit off on that one. Later on, we went back and I put a face of composite of a lighter color to kind of match the color a little bit.
So we might, you know, change it to Maryland bridge in the future, but it was kind of one of those things where I needed a tooth, and he just kind of made it happen with, I don't know if other dentists do that, but it was an invention as far as he was concerned. So I just wanted to, I'm going to get this out of my way. You guys can't see it, but I can. I just kind of wanted to like do another summary of, I forgot that I didn't have. And when Dr. Martin Weiss heard that, he said immediately stop taking that. So my pituitary tumor was also unusual. It secreted 2 different hormones. That's not, I guess, a usual pituitary tumor. So if anyone's interested in that kind of stuff, that was another thing about my health. So from an age perspective, at 14, I had surgical and orthodontic procedures on 6 and 7. 16, I had a onset of my menses, and I believe it was delayed. 17, it tapered off and terminated. At age 20, I had a blood test and MRI confirming that I did have a pituitary tumor growing in my head. And we now know that it was growing for years there. At age 20, I had surgery and radiation. And then at age 25, I had successful fertility treatment. I did a C-section birth. At 29, I was diagnosed with gallstones. At 32, I did extreme nutrition exercise, had 1 cycle, and was pregnant 4 months later. And then at age 43, I had my first thermography report indicating oral pathology. I had a second report indicating oral pathology a few months later. And then at 44, I had a saliva test verifying oral pathology, and we decided to go ahead and extract the tooth. And, you know, on the way home from the extraction, I was thinking back to this documentary I had watched many years ago. And, you know, I was talking about the oral systemic connection and the idea that maybe your teeth fall on a meridian line. And I had found that documentary intriguing, and I had actually had a very good friend die of breast cancer in her 30s. And we went back actually after watching that documentary and looked and verified that indeed James had diagnosed a failed root canal that needed to be dealt with on a tooth that fell in that meridian line. So we did kind of think that was interesting and something that was sort of in the back of my mind. So we're on the way home from this extraction, and I'm just like, I wonder, like, what is number 7 connected to? And so I search it on my cell phone, and this picture pops up, and I see number 7, and this is the first thing I see, pituitary. And I'm like, you have got to be kidding me. All around, this is of course number 6, but gallbladder, fertility. And I said, James, you're never going to believe this. Like 6 and 7 are like my entire health history, you know? So I was really at that point just shocked on many levels. I was thinking to myself, do I even know what it's like to live normal, like without a constant tooth and sinus infection? No wonder I'm always tired. No wonder I've, you know, always get sick and it lasts forever. And I just feel so different. I feel like something's wrong with me. And I was just really just mulling over this, wondering it in my mind, like, could it really be, like, is that the root cause of what's been going on with me? I included, this is just the first page of that imaging talking about my tumor and information in case someone wants to go back and look at that. But I, at this point, was just really like, I'm going to take this whole bacteria thing seriously. And so stretch of antibiotics and my gut with good bacteria. Laura will probably tell you I went too crazy, but we were doing all the things. We definitely wanted to try a lot of these products anyway, because we, you know, by this point, we're like 100%. I mean, my true prayer is that every patient in our practice would saliva test. I think it's just so crazy what we were able to discover through a saliva test. And so I just feel so strongly about it. But I've been taking the Stella Life probiotic for my gut. I've also been doing the Ortho 225. We're making our own milk kefir or kefir, however you want to say it. And I'm trying to take that daily as well. I'm brushing with Supermouth. And that's another thing too, you know, yes, I'm married to a dentist and everyone thinks I should have great oral habits, but I didn't. I had great teeth. I never got any fillings. When I would go get my cleanings, I hardly had any calculus. So I never flossed, and I brushed once a day, maybe twice. That was my oral habits up until this point. And then I realized, okay, this is more than just about getting a filling or keeping calculus away. This is about maintaining the biome that's in my mouth. So I have been flossing at least once a day and brushing twice with Supermouth toothpaste. And I also do Probiora at night as well. And I am just taking it so seriously to repopulate my gut and my mouth. And, you know, I know that there's sort of like a maintenance schedule, if you will, at some point, but for me, I will be taking one of these products for the rest of my life. It's not worth it to not for me. So, and then we also decided to go ahead and retest. So a month after my first saliva test, which was basically 2 weeks after my extraction, I took another saliva test. So before, you know, I went ahead and highlighted for ease of seeing this, what was good. This is my before test, what was good and what was not. I had the upper, UML on the Prevotella intermedia here. And then I had a red complex that was pretty high and a couple other orange complexes. And then this is my test 2 weeks after the extraction and basically 30 days after my first test. And every single one of them here is in a good place. And I felt so empowered by that. I was happy about that. And, you know, this wasn't just about trying to get rid of the bacteria that was clearly happening in my mouth on a really high level, and I believe making me sick, but it was also about the heart disease and the cancer and the Alzheimer's and the things that are connected to these bacteria that aren't in my body anymore. And I feel so empowered. I can go back and test whenever I want, you know, and verify that I'm still doing a good job in this area. And so this was just, this is it's the best way I can say it. It's an empowering tool for patients, I believe, and for providers to give concrete evidence of what's going on. You know, we just had a patient saliva test. She had 2 really high bacteria strongly connected with cancer, and she just got diagnosed with cancer, you know. So if we can address what's going on, maybe that will help her chemo treatments. You know, I think it's just so incredibly powerful. So a month after the extraction, I decided to have another thermogram as well, because I wanted to see what was going on in my thermogram. And when I first saw my after thermogram, I was disappointed because it looks like things are going crazy in my mouth. But the more I look at it, especially side by side, I'm feeling so good about it. So for those of you not as familiar with a thermogram, it's basically a thermal camera that takes imaging, and I do my whole body, not just for breast health, but I figured, well, hey, is there anything else going on in my body? So I did my whole body. And the scale is, you know, it goes from like yellows, oranges, reds, all the way, and the colder side is blue, and then white is the like hottest. So if you look at like the ethmoid, like sphenoidal type sinus area on my before, you can definitely see a lot of stuff going on here, even to have white right there. And then of course my infection that I had going on, and we believe this is lymphatic drainage right here. And there's lymph stuff going on here, another really hot spot. When you look at my second image, like my nose isn't as cold. I don't have these things going on in my forehead that I had before. My dark red is all but gone in my shoulders here. So I believe what's going on here is sinus drainage. And I will get to that too, because I want to talk a little bit about what's happened to me since pulling this tooth. But you know, I don't read these for a living. They're still indicating, the report still indicates there's something going on there. So obviously I'll want to have another thermogram. But I'm encouraged by these results. I think my lymph system is clearing out and getting better. And so I am grateful for this tool as well to kind of keep track of what's going on in my body. So I definitely have had noticeable physiological changes since the extraction. And I'm sorry if I get a little bit too much information, but I just really need to share with all of you what that has been. So just about instantly after him pulling my tooth, I had extreme exhaustion and lethargy. To the point where I was like, man, what is wrong with me? I was even discouraged. Like, I thought I was going to feel better. What is going on? I'm kind of a little bit of a workaholic, so it's hard for me to just sit on the couch, but I was, okay, what can I do sitting down? What can I work on, you know, sitting down? Because I even just walking around felt like it took all of my energy. We make a point to not make plans on Saturday. And I think that first Saturday I slept in till 2 o'clock in the afternoon or something crazy. I was sleeping a lot, just very, very exhausted. I'm still tired, to be honest. I'm feeling my energy. It's been over a month and a half now, maybe not quite 2 months since the extraction. But yeah, my energy is getting better, but I'm still tired. And like I said, it was discouraging at first until I saw, gave it a little bit more time. So the very next day after the extraction, I woke up and I had to blow my nose. And I know that sounds like perfectly normal, but for me, it's not. I'm not a very mucusy person. I've never had a bloody nose. Like my mom has no memory of me ever having bloody nose, and neither do I. I'm not a runny nose type person at all, which was one of the reasons why I thought it was so odd that I had such severe sinus issues, because you'd think you would be mucusy, but I wasn't. The next day I was blowing my nose and like chunks of things were coming out of the right side. And that has been happening almost every morning since. I am just, stuff is clearing out of me. And especially on this side, I have been doing just most recently some nasal rinsing. It was extremely painful for a while, and now it's feeling better. But definitely my sinuses are clearing and my body is working on that. 2 weeks after the extraction, I felt a fullness in my ovaries. And that was really surprising to me. I don't have a lot of menses to speak of. As you know, I had one when I was 17, one when I was 32. And so, but I'm very familiar with where my ovaries are because of the fertility treatments that I did, where they had to do internal ultrasounds and jam that internal ultrasound up onto your ovary and be pushing on it and really looking at it. I know exactly where my ovaries are and what they feel like when they're full. And I was feeling a fullness in my ovaries. And that is something I haven't felt in like since probably doing fertility. And I was also experiencing breast tenderness, which was so crazy to me. Also something that I am not, that's not normal for me in any way, shape, or form. Also, I mentioned before, I kept my gallbladder. So I'm very familiar with my gallbladder as well. Like when it feels like my gallbladder is squeezing and I have like almost grainy congestion, like the bile trying to squeeze out of my gallbladder, like I can feel that. And when my bile is a little bit looser and more smooth, I can feel that too. And a stone will pass easier that way. I noticed after the extraction that it feels like my bile, like when I do pass a stone, it's very smooth and easy and just happens almost as if my bile is better. I can't prove that to anybody, but it just feels different inside there. And I have kept my gallbladder all these years because I do not believe it's a vestigial organ. I think it has a purpose designed by God, and I would love to heal it and have my gallbladder. And maybe I have hopes of doing that now at this point. But I do feel a difference in that. A month after the extraction, 1 month after, all of a sudden my stools started getting extremely loose to the point where I would say it was absolutely diarrhea. And the weirdest thing about that was that they were orange. And I mean, I'm not talking a little bit of orange. I'm talking a lot orange. And I was not eating carrots or anything that would make that happen. And I told James, and he's like, that's not a normal color. Like that is not, you Google it and it's like, are you eating carrots? Because I don't know, but he looked up the Prevotella intermedia, and this is a picture that we found online. And you guys probably know a lot more about this bacteria than I do, but I found it interesting. It's a black in color bacteria, but oftentimes as we're looking at pictures online, it's like an orangey red, orange to orangey red to red looking color in the Petri dish. So I think and feel like I have been detoxing, and I feel like that crazy, weird orange stuff that was coming out of me might have been the toxins that were cellularly like coming out. So again, can I prove that? I didn't keep any of it for a stool sample to be tested, but it was definitely a weird experience for me. And that lasted for a couple of weeks, and I'm still kind of actually having loose stools. And that didn't, I am also taking kefir and things like that can cause that. But I've even tapered off on it, and just to see what would
And
happen.
you were
And
taking the kefir right away, and you
I
were
was
fine
taking
for the
kefir
first
right
month.
away, and actually 3 times a day I was doing kefir for a while, and I didn't have any problem with that. I've also experienced a bit of weight loss, which I'm not going to complain about. I guess it depends on what day and time I'm standing on the scale, but it appears to be somewhere between 5 and 8 pounds. I certainly haven't tried to lose weight during this process, but I will definitely take that if that's going to happen to me. But that is definitely something that's happened. And then, I would say there's just one particular thing that's happened to me that I don't care who you are, you just cannot deny the oral systemic connection, because literally 1 week ago on Wednesday, the whatever that would have been, the first, I guess, I started my period, and I have not had a period for about 13 years, right before our son was born. And it has been a crazy experience. It is a truly normal cycle, I think. It's just tapering off now at 7. Today's the 7th day. And it's just, I think I'm finally done with it. And our staff said, "Are you going to have a baby? That would be the greatest testament to oral health ever." So I'm not sure, I have to say, I'm definitely not going to stop it. I cannot believe that for the last 28 years, I've been trying to figure out why I don't have a period and what is going on with my body. And everybody thought that it was the pituitary tumor. And here I pull my tooth, and a month and a half later, I start bleeding. You cannot deny the power of that. And I am so moved and overwhelmed by it. I just have to tell everybody, please consider the oral systemic connection. It's incredibly powerful. I think those of you who are here watching this live right now obviously recognize that a little bit, or you wouldn't be on this forum. But for us, this is something that we want to encourage our patients, our friends, our family to be doing. And I cannot believe, after a month and a half, the major changes that have happened in my body. And I truly have hope now, after 30 years, that maybe I might know what it's like to actually feel normal. And so I'm grateful for you all. I'm grateful for Laura for doing the class. And I just praise God that James went to it with our hygienist. And I thank you too for just listening to my story. And I hope that you can take something from it. And I'd be glad to answer any questions if we have time.
Well, I just want to say thank you. You gave me goosebumps when the ending. I just think what you're saying, and everybody's health journey is different. But I hope a few people had takeaways who've listened to me long enough about oral systemic connections. Of course, we can never make a direct connection, but as a saliva hacker, those are the insights that I'm always looking at somebody's medical history, and then looking at that saliva test and knowing the TF was there in that red complex. But we're really talking about her orange drivers, right? Why was that PI, that Prevotella, in that upper measurable limit? But she also had, those of you who follow fertility and infertility issues, if you saw in her original test, that FA and FN was also very high. So again, as a hacker, those are all things that, of course, now we can go back and draw those right up to, but the first part was getting her healthy. And I think that is always the thing, is how do we create health? That was our first conversation, right? Kara's like, okay, wanted her to get a CVCT. They chose prayer instead. And I
was like, pull this thing out.
Right. There is personal power going through all her, previous tests and what she had done, which we do have an expert here. I think he's still on with us, who made a little comment. Dr. Bill Hang, if you're here, I'd love for you to speak to the first part of her story, which is where it started as a teenager, having that procedure done. And you were speaking to how we shouldn't do that anymore. Can you
I'm
just
happy.
speak to that?
I'm happy to offer some thoughts. Here I am sitting on my porch in North Carolina. It's all the frogs in the trees making noise. And hopefully you can still hear me. By the way, congratulations on escaping California. We did that just over a year ago. It was a great thing, and there is life beyond California, but let's not talk about that. Your impacted cuspid situation is a very interesting one. I studied that very thing and saw every case ever treated at the University of Minnesota prior to my being there, and I taught ortho at Minnesota from 1974 to 75, did a study on impacted cuspids. If indeed that cuspid position was similar to the one that you had in your own mouth, you didn't need to have that cuspid uncovered. Probably removal of the primary cuspid would have allowed the tooth to erupt on its own and avoided the whole problem. What I think happened here with the root of the lateral incisor probably very much was associated with the trauma associated with that uncovering, but that's like a 1 in a zillion thing. So many people have had cuspids uncovered without any problem. I mean, I've tried to prevent, and I have prevented impacted cuspids on hundreds of patients over my career, but I've never had anything as bizarre, bizarre as your situation. Oh my gosh.
Pretty crazy.
Yeah, you take it to another level here. That's really congratulations to both of you for being right on this whole thing. It's a very interesting thing, and the whole diagnosis of this is amazing stuff to me. Here I am retired, and I'm still learning and very happy about that. I'm still learning and hopefully being involved. So I'd love to talk to you more about your escape from California and
yes, we would love to talk about that with you too.
I understand where you live because I'm a Midwesterner actually, and I know that you live near Branson, Missouri, where or south or near Springfield. I know the whole area very well. Yeah.
Well, Dr. Hang, I want to take away nowadays you would what? Expand and allow that to come down. Is that what I'm hearing from you?
That would be true, but in reality, it doesn't necessarily mean that there was a shortage of space. What really happens here is there's often a family pattern. Now you're adopted, and it's probably very impossible to get records on other family members. But if you really were able to do that, you would find probably that there are aunts and uncles in this family pattern who also have impacted cuspid problems going on. And what I determined was that there's a way to prevent all of this, but you must start this whole process to prevent impacted cuspids starting at age 6, when you might notice, for instance, that a lower primary incisor is over-retained, causing a permanent incisor to deflect toward the lingual. This is a prime warning sign that the same thing may happen for an upper incisor. And then if that happens for an upper incisor, you may see it happen for a cuspid. Cuspid impaction occurs in 2 to 3% of the population. If you remove the primary cuspid at an appropriate time, the cuspid will erupt on its own and not have to have the joy you had of having that cuspid uncovered, a bonding pad with a gold chain put in, and then have the orthodontist act like a fisherman and reel in your cuspid. And that's what was, yeah.
Yes. We actually have a patient, well, that x-ray that I showed is very similar, I believe, to mine. I didn't have access to my own.
I would love to see yours if you could find it, but it's probably impossible.
Yeah, I mean, it was 30 years ago, and it's a retired orthodontist, so I'm thinking the records are probably MIA, but definitely James might even be interested in talking about that patient with you, because I know they're going to consult with an orthodontist right now.
I would love to. I'd be happy to do that. You email me or contact me, whatever way. I'm happy to help you.
Thank you so much.
Yeah, I'm semi-retired, and I need a reason to get up in the morning. So happy to help.
Okay.
Yeah.
Well, enjoy retirement.
I am, believe me. I keep my wife crazy here. I drive her crazy.
That's for sure.
Thank you, Debbie and Dr. Hang. I do want to open up for questions. Those of you that are saliva testing or have questions just about testing itself or the connections, or anything, or questions to both Dr. Sweeney and Kara. Gonna open that up. You can raise your hand or unmute. And Dr. Gina, I'm going to ask you to kind of chime in here from a medical standpoint. We were just talking about that impact of creating health when it's truly our passion that what we do together. I know I had spoken with Kara. I talked to her about Dr. Gina's GI gems, we call them, but one of the things I stressed to Kara and Dr. Sweeney was we're not just treating the mouth, we have to treat the gut. And so that was a big piece of the protocol.
Laura, if you are not going to use oral antibiotics and you're using antimicrobial rinses, when do you start doing the probiotics? And, what's the place of oral antiseptics if you're trying to use probiotics?
Well, that is a whole session in itself, but I'm going to say if you have resistant bacteria, which she did have a TF strain, we would not use any type of biocide or antimicrobial. We're actually going to stick with, you saw, more natural products, the things that would sustain a healthy environment, or what I call allow the healthy species of the probiotics to grow. So we're actually going to move away from that. And that's why saliva testing is so important. She had two of the biggest, what we call resistant strains. We know that TF forms an oxy-R protein, and that protein allows it to thrive in these low-level antimicrobials. And it's not just one. We have, over 40 published papers on this, from your CPCs to your chlorides to your hydrogen peroxides, you name it. You can have really good research around that, but that's why we want a saliva test. If you don't have those species, then antimicrobial away, but you do have to keep them away from your probiotics. So in this case, our whole focus was on the systemic, what was going on systemically. Her levels were past 1,000. And so we know that they're just recirculating through that bloodstream. And that's why antibiotics were chosen. If that wasn't a concern systemically, then, and you didn't have species that are resistant, then you could use antimicrobials. But that's why saliva testing is so important. You really want to understand that piece, because choosing the appropriate products was really important for us. We needed to allow those probiotics to work.
Now, someone had said, and I don't know if it's true, that the Stella Life rinse does not, targets pathogens, but allows healthy bacteria. Is there any truth to that? Can you speak about that Stella rinse?
They just did a study. They just released it, I want to say last month in July on that. So you can go pull that off the internet. And they did show that it doesn't create resistancy. But, I say there's about top 10 right now. That's what's really cool about being in dentistry in 2024, is that we're getting more and more of these types of products. That's one of the reasons you saw Supermouth. It's the same thing. It has K2, D3, sodium bicarbonate. It has xylitols, erythritols, things that are going to be, it has inulin. So we're looking for those prebiotics and things that are neutralizing the environment. And so at the top of the list right now, yes, you have your Cell Lifes, you have your Supermouth. I would even speak to like Dr. Jen's, to David's. There's even Osacare. There's a lot of them that are coming out on the market. So again, it's the ingredients that we're looking at that are part of either having a prebiotic in them or able to sustain and help those probiotics work in synergy. Not killing, we're not focusing on just killing. And so it's really a mind shift.
But it seems like the standard of care then for people that have red and orange and high amounts is to go on antibiotics and then to go on probiotics and not use the antimicrobial rinses.
I would be more clear, and it really depends, like Kara's case. That's why understanding oral systemic, those that want to get in depth can understand that. But for me, I'm going to speak for me personally as a saliva hacker. There is a line in the sand for me. Once you have red complex, those are going to mitigate and cross over any lining in the body. So they are in the bloodstream. Now we could look at, are they low in the green? And that's what we teach, at what level. Where she just had the orange complex, we could have argued maybe not using an antibiotic. But again, that's why saliva testing is so important, because all of her medical history were also lined up with her highest orange complex, her PI, her FN, her FA. And so again, that would have been a personal decision, but she had the leader there, the driver, the TF present at a very high level. And so she's
Thanks.
over 1,000.
Yeah, that's a great answer. Thank you.
Yeah. Dr. Gina, what would you like to add to that, just both medically and about the case?
Well, I do think we're going to have to record another session with a debriefing to this story because there's so much to say. Thank you, James and Kara, for sharing with us tonight and for being so brave in just wading right in and pulling out that front tooth and doing what you had to do. It was the right thing, no doubt about it. And as time goes on, we'll see that more and more as your health continues to improve. One of the things that I would say in relation to what Jack was just asking about is Laura and I have done enough cases together now. And I always tell this to the patients. We hate antibiotics, hate them. I don't like to prescribe them, but I like them better than a stroke. And I like them better than a heart attack. And we protect the gut with, Laura was calling it the GI gems, as best we can to prepare the GI tract for what we're getting ready to do in terms of wrecking it. But if we don't time it with the oral procedure, start it before what the work done in the dental office, and then follow up appropriately with the antibiotics afterwards, again, while supporting this human being from tongue to tail, I say, and supporting their immune system every other way possible, then we find ourselves fighting it over and over and over again. We don't ever just knock it out. And whenever we put those antimicrobials on there, and this is certainly Laura's area of expertise and Whit's area of expertise more than mine, but I have seen enough cases with them to say that the local application of that is just fooling all of us, because we see a resurgence, like Laura was saying, like crazy afterwards, of these bad bacteria just taking over again. So we really haven't supported the patient's own immune system while suppressing and knocking out at a systemic level. So we've seen it work time and time again, but we agree with you. We were hesitant at first to just say, we got to use antibiotics in those red complexes and otherwise. So anyway, I have lots to say about this. It just makes us so thankful everyone is here and asking why, and continue to ask why is the patient in front of me experiencing what they're experiencing. And to say, I know what I see with my eyes, but based on what we're learning in oral systemic conferences and in literature, something's happening at the cellular level that I don't see. Whether I'm in the non-dental medical office, things are happening at the cellular level. Blood pressure doesn't tell it all. Lipids don't tell it all. We need more testing, and that's where saliva testing connects us. And then in the dental office, time and again, Laura will call a dental office and say, we have a patient we want to collaborate on. They'll pull up all of their records and they'll say, no, they don't need anything because they look pretty good. It's not what we see with our eyes. It's what we can see at the cellular level. So thank you again, Karen James, for joining. So we'll do a follow-up recording to talk about many of the topics, as your story will save a lot of lives. We appreciate you.
Thank you so much.
We are so thankful to y'all, James and Karen. And I agree with everyone in saying thank you for coming forward with your story, because your one story is something that we're going to remember every day when we're in our practices looking at patients that have strange and unusual things going on, and understanding that, you know, the mouth is the gateway to the rest of the body, even into the sinuses, that, as you've so well described, and that we're the gatekeepers. We have to wrap it up as we've promised by 9:30 Eastern time. But Laura, there's been several questions posted and mentioned about courses and new things that we're doing. So can you share with us what you've created in this power of testing, which really I hear a lot of people asking about that. So what's new that we can take advantage of?
Yeah, we offer an introductory course, and it really is just a small introduction to see if you are truly curious and interested in taking this path on. It's only $99, and it does cover just two of the hot topics that we were talking about tonight, antibiotics and antimicrobials. It doesn't go in depth, but it gives you some of that research where it's coming from, and allows you at a very small entry level say, hey, I want to learn more. And those that want to learn more, I do offer a one-on-one 3-part Zoom sessions just with you and your team. You can email us at IDM. We will be posting that online for those that are interested in training and doing that one-on-one to create your own personal protocols. As I see, some of the questions are always like, I don't know what to do next. I don't know what to do in my office, or what I would tailor, or how I would make that different. And that's what we're doing there. And then we do have our online, or what I call on-demand courses, and we're going to be introducing some more on those, just on testing, as well as with you, Dr. Wilkerson. We have your whole airway, and so sleep testing, and then Dr. Gina is going to be putting on for the blood testing. So it's kind of an evolution, so that you can work kind of step by step, starting with the saliva testing, kind of understanding, what are we doing in the dental? What do we know our dental part? Can we execute our part all the way through sleep testing, and then those blood markers, so that we can pull the oral systemic collaboration together?
Thank you. Well, I think tonight we've been so stimulated, and thank you again for being with us, James and Kara. And
you.
God bless you in your journey. We want to keep up with you, because I'm not sure James wants to have 6 or 7 children, but they may be in the future. But anyway, thank you all for your commitment to being on the front lines of what we're learning. It's so exciting. We'll keep you posted on new things. Our next study club meeting is on Wednesday, October 2nd. And we would invite you. We've got room for a lot more people. So if you have dental friends that are dentists and hygienists and just interested in this subject, please invite them to join our study club and become part of it, because as you can tell, just tonight is something that we'll never forget and will impact us as professionals for the rest of our careers. And we want to create experiences like that for you and help you in every way that we can. So thank you, Gina and Laura, and thank you, Kim and Kara and James and Bill and all of our gang for being together tonight. Hope you're having a great summer, and we'll see you, if not before October 2nd, we'll see you then. Also, our AOSH meeting is coming up in Reno, and that's on the 11th, 12th, and 13th of September. So if that's something you haven't signed up for and would like to hear lots of really wonderful speakers and researchers and clinicians, then come join us at the AOSH meeting in Reno. We'll be there and participating in the program and interacting with all of our good friends there. So until then, take care, and we'll see you soon.
Thank you.
Thank you.